Haven't an HEH Mind is an independent charity. We've been established for 35 years now, so yeah, huge kind of enriched history.
We offer a whole host of children and adult wellbeing services and children and adult crisis services. We work very closely with workplaces to support them, and we also do some work around suicide prevention and supporting organisations where there's been a suicide.
All of our funds are raised locally within Havant and East Hampshire, and they're spent within Havant and East Hampshire.
The new strategy is 2025 to 2028. It gives that sense of purpose, clarity, direction for the organisation.
Historically, our strategies were sort of developed by SLT alone, and this time around it's felt really collaborative.
We looked at where are we now?
Where do we want to go? What is the purpose of Havant East Hampshire Mind? What's important to us?
What feels different is the breadth and depth of ideas that are now in that strategy. It feels very innovative and filled with passion.
As a charity, you have to be nimble, you have to be curious, and you have to respond to what you're dealing with. Being static isn't an option.
We're at a really crucial time where there's a bigger demand for mental health. It's more complex in a sort of challenging external environment, and I think there's a real need for us to develop what we do and respond to unmet need.
Over recent years, there has been increasing demand for acute services, so people who are in crisis, who need help immediately. And so we've developed both adult and children's crisis drop-in services out of hours.
So we know there are a huge amount of neurodivergent adults that are receiving late diagnosis or are unsupported, and there's a real crossover and overlap with mental health, so that's an area that we're really keen to respond to.
The feedback that I hear from clients is that there's nothing else like this that's supporting clients in their neurodivergence and their mental health. A lot of them will have tried CBT tools, which is a lot of the tools that we use. And for the neurodivergent mind, they don't always work. So I've had to think outside the box and really draw in on my own lived experience as a neurodivergent person.
Our staff and our volunteers are often former service users themselves. They have found that their way to recovery and to maintaining their well-being, and they feel like they would like to share that with others and to give back.
Lived experience is so crucial, and we're really passionate about that within our staff, trustee, senior leadership team, as well as volunteers.
I suffer with reoccurring depressive disorder, and I've had quite a few breakdowns in my life. I've suffered with my mental health from a young child, and always wanted to give something back. So I decided to volunteer.
It's just magic. It's that human connection.
Because of the economic circumstances, obviously there's a need to be working in a joined up kind of way so that we're maximising the impact of the relatively small resources that we have. My role, particularly within efficiency, is around looking at the service spaces that we use, and some of those are our own, some of them belong to partners. We've got a huge geographical patch from sort of Havant right out to rural East Hampshire. So it means that we have to have kind of multiple locations, but having those partnerships in place where we can use that space and maximise a trip for somebody who's coming to see us. One of the areas that I'm particularly looking at is our carbon reduction plan and our environmental impact. So we're looking at the types of buildings that we're in, the energy usage that we have, staff travel and user travel, and trying to make efficiencies and informed ethical choices about the way we purchase products that we use in our day-to-day delivery of our services.
We don't operate with ego.
So we aren't arrogant to assume that we have all the answers and all the ideas. We're really passionate about collaboration because it gets better outcomes for service users. It gives a much richer, more holistic approach.
When you're thinking about partnership working, it just allows us to be wider than just us. You know, we're stronger when we come together.
People are never one-dimensional. There's quite complex needs that need to be addressed, sometimes in a particular order or sometimes at the same time. And having the right partners working together can help that to happen more successfully.
When we first formed the KIC, it was perhaps something that was very new. We weren't sure how it was going to work, but very much that's working to our benefit, working with Solent Mind and Andover Mind. Being able to cover the whole of Hampshire is going to be really, really beneficial, and very much that learning from each other as well.
So we have wellbeing workers in some workplaces. We give advice about having wellbeing policies and procedures, and also suicide prevention plans in organisations, so sort of that consultancy. And then we also deliver training and things like mental health first aiders or mental health champions.
In our children and youth provision, we have two partners. One's called Motivate, another is Music Fusion. We've done an awesome project with Music Fusion where we've sort of done some creativity, and the young people have done this for songwriting, drumming, all sorts of things, and then we provide the wraparound mental health support.
We've also recently worked with Two Saints and No Limits on bringing them into a provider collaborative agreement for the purpose of our safe haven delivery services, and that's inclusive of adult and children and young persons services. When we were looking at the figures around mental health, it was really clear that whilst things have come on and mental health may be more spoken about than ever before, we've actually got a huge amount of work to do.
I think it's really important to tackle stigma around mental health because we are seeing quite a high number of suicides and attempted suicides, which is actually quite prevalent within our male demographic. And I believe that it's still quite difficult for people to talk about their mental health and the struggles they're having.
You know, I think all of us are touched with mental health issues at varying stages of our lives, and we all need help. We're all human.
We want lived experience to impact the policies, the procedures, the bids that we write, the innovations that we make. So it's felt at all levels of the organisation.
Mental health problems are health problems, and it's everybody's business to make sure they tackle that.
The darkness, pain, isolation, low self-esteem that people feel when they're poorly, that not wanting to be here, we know that darkness, we've lived it, and then it just cultivates in you, a purpose and a desire to bring about joy and kindness in people's lives, and I think that's what makes a difference.
I would encourage anyone to reach out to having an East Hants Mind. Reaching out and asking for help is a sign of strength. It's not a sign of weakness. And there isn't anybody on this planet who isn't affected by mental health issues.
If you are struggling and you do need to reach out, please do. You deserve it, and we can really help.
We're here to listen to anybody. No question or concern is too small or too big.
We want to offer services that are open and inclusive, and our hope is that you're met with kindness and you're heard and you're listened to. It doesn't have to be like it is now. It can get better.
If you've got questions, if you've got ideas, we can only be as good at delivering what you need if we're in constant dialogue with you.
If you're interested in the strategy, if you want to find out more about what we're going to be doing over the next 3 years, please come and check it out. It's online on our website at easthantsmind.org. And if you've got any questions or feedback, feel free to contact us at info@easthantsmind.org.